Okay, hi everyone. Hopefully the feed is working today. I'm Dr. Alana, for those of you who have never met me, hopefully you have, with Pure Pediatrics. And today we have a wonderful special guest. This is Dr. Bryn Cooper. She's with Cooper Orthodontics, which is, we were just discussing location, Rice Military area, close to the Heights, kind of, great access for most of Houston as far as I can tell. And today we wanted to do a talk about teeth, because in the office I get asked all the time questions about little babies' teeth, when to see the dentist, how long can I have the bottle, how long should they use the pacifier, is thumb sucking good for you or bad for you, what's up with tongue tie. I don't know, just I get a plethora of questions, and a lot of times I'm like, that's a great question for the dentist. So we thought we'd invite a dentist, and she's an orthodontist, and so the other questions I get is, when do they need braces, and what's kind of the coolest, latest with braces? Because even my own daughter is she'll be 12, and so I'm looking at her teeth, I'm like, yeah, she probably needs braces soon, kind of dreading it, because I just remember all the metal, and I never had braces. So I actually added this on the little thing yesterday when I posted the event. Fun fact, never had a cavity, never had braces. I feel like I saved my parents a fortune.
You did.
I know. And I ate all this candy, so it wasn't that. So anyway, so thanks for joining us. Tell us a little bit about yourself, and then I have this list of questions. And then if y'all have any questions, feel free to add some in, and then we'll answer those too.
So hi everyone, I'm Bryn Cooper. I'm a native Texan.
Yay.
And I went to dental school the same place Dr. Alana went to medical school, San Antonio. Yay.
It's fine backwards.
And then I did orthodontic residency in St. Louis. And then my husband's parents are in Austin. My parents are in Dallas. And so he looked at me and he was like, where do you want to go? And I was like, well, we don't want to pick one over the other. So we chose Houston. And my father actually grew up in Houston, so I'd been back visiting my grandparents a couple of times. And so I felt like I wasn't coming back to some strange place. I felt like I was coming to a city that I knew pretty well. So here I am and have my own practice. So, yeah.
And adorable little girl.
I do have a little girl who just turned 20 months.
So cute.
And
so cute. Perfect teeth.
So far, I think she might have her father's teeth.
Is that good?
Yeah.
Okay, good.
Yeah, he had like really short amount of braces when he was younger with like no major issues. I, on the other hand, had orthodontics 3 times before I graduated high school.
Wow. Maybe that's what inspired you.
Yeah, so I had, like, when I prescribe things to my patients and people are like, oh, how does this feel? I'm talking from actual personal experience about 75% of the time. So.
Oh, wow. Okay, yeah.
That helps.
Right. And then I have 4 kids, so when I give a lot of parenting advice, a lot of it is because I've had 4 kids. I've lived it, so yeah, same thing.
Yeah.
Pretty much. So I do also want to point out that Dr. Cooper has a podcast, and it is called The Bryn Cooper Show.
It is. We have different segments that have different titles, like Teeth Truths. We dig into some marketing stuff that's out there, or research for the people. I take research papers that are coming out, and I try and explain it in a way that just anybody could understand. So that's kind of fun. And then I like to answer questions from different patients and things. So any social media outlet, if you have a question about teeth, if you, of course, today we'd love for you to ask it on this Facebook Live, but in the future you can always find me other places.
Yes, super cool. We keep saying we'll start a podcast, and then we keep running out of time. All right, we'll get there. Okay, so thanks for coming. All right, so I'm going to start, and I'm going to ask you, I've made this list of questions.
Yes.
And so I say, pray tell. I get asked this all the time. Parents start to worry. One, they think their baby's teething at 2 months because they start drooling. I'm like, no, they're just drooling.
Yeah.
And so most of the bottom teeth usually erupt first, correct?
Correct.
And around 6 months is the earliest, on average, that I normally start to see that.
Correct.
Yes. And parents shouldn't freak out if the teeth haven't erupted by, say, what age?
I mean, I think almost up to a year is normal. So most of the time it's about a 6-month leeway on either side. And even so, every child is on their own time schedule.
Yes, just like development.
Yeah.
Right.
So what we look for is symmetry more than an actual chronological time clock.
Okay.
So if you have one lower incisor, the other one should come in. And then if the uppers come in, you should see it on the other side, all within 6 months. So that's kind of the general rule of thumb. And so if you see one of the front two come in, and then you already see the second to front two come in, and they're coming in, and the other one hasn't shown up, that's when you say, okay, let's go get this checked out by a pediatric dentist.
Okay, so it's more of the timing and the order of them.
Yes.
Yes, because it's usually bottom two, top two, some guys, and then all the rest start coming in the back. And
Yes.
I find that these, when I think about teething or parents complain, I feel like it's more prominent when they're like toddlers, when they're getting these, as opposed to like this first little cute baby tooth.
I agree.
Although I feel like parents tell me more about it when they're getting the first baby tooth because they just don't know.
Yeah, they just haven't experienced it. And anything that you haven't experienced before, you're going to ask more questions about, right? So.
Exactly. All right. What about teething cures? So I get asked a lot, and there's a lot of stuff over the counter.
Sure.
I'm not a big fan of just giving your baby Motrin because they're teething.
No.
So they usually don't need that. And I always remind everyone, like, your puppy, like, you know, we had a puppy. I think she has a whole set of new teeth now, and I didn't even notice. So, in some sense, so what are good teething cures that you have that you normally recommend?
Yeah, so once again, this depends on the kid because every kid is going to have something that's different. But what's going on is they're just uncomfortable. They're experiencing something and they don't understand it. And so what I've tended to recommend is like, okay, try the cold teething ring. It ends up being more of a distraction than like it actually numbs their gums because most of the time they won't keep it on there long enough for it to actually numb their gums. So, but it gives them something that they're kind of not used to and it keeps their mind off of it. The other thing is go someplace with lots of stimulation if it's during the day, and it also helps wear them out, you know.
Exhaust your baby.
A little bit, yeah.
Okay.
And then at night, there are those little like numbing pods. Be careful. Read those ingredients because it helps some kids. But once again, they kind of put flavor in it, and so I think they like that.
Yeah.
And then cold washcloths, you can just freeze those in the freezer. That helps a lot, and that's a little bit easier for the babies to handle than the frozen rings that are really cold on their hands.
Right.
And then otherwise, I mean, they do things that are comforting, like giving them a bottle. Don't overfeed your child, but maybe give them, you know, less formula to water, but more bottles or something like that, where you can kind of help them with it. And I mean, my kid loved toys, so I would give her like soft toys when she was upset, and that would help her. So it's a comfort thing.
Yeah,
I think.
Yeah, it's more of like a soothing, and so it's more that they learn self-soothing techniques, and yeah, I agree. So when my kids are little, the wet rag, we would just wet a rag, you know, like one little hand towel, you know, and throw it in the freezer, and then just pull it out, and it's all crunchy, and they just gnaw on it, and I was like, that's all you need.
It is.
But we never gave them Tylenol and Motrin. So not a fan of Tylenol and Motrin for it. I felt like they didn't really need that, and so.
Really, really rare. I think I did it twice in like 20 months. So
not bad.
I think that's low.
That is low.
Okay.
That is low. What about cleaning baby teeth? So I get this question a lot, like their little teeth come through, and then the parents say, do we need to clean them? And I'm like, I'm going to go with yes. It's like when they ask me if things are contagious, I'm like, absolutely. I mean, I don't care what they came in with. I can assure you it's contagious at some point. Sure, that's how they catch everything.
Yep.
So, yes. Teething is also contagious.
Teething is also contagious. So as far as cleaning the teeth, if you have any sort of white showing, you have to clean it. That's the rule.
White, clean.
White teeth in the mouth, clean it.
Okay.
You don't have to start with a toothbrush or toothpaste or anything. When they're young, probably under a year, just a damp washcloth and just rub it and get the sugar from the milk off.
Okay. So especially before bed.
That's the most important. Whenever they sleep the longest, right before they're going to go to sleep the longest, that's the most important cleaning of the entire 24-hour period.
Right.
Because they get dry mouth when they sleep. All of us do, but babies do too. And then the milk has sugar. Doesn't matter if you're on formula or breast milk or anything.
Yes.
It can be completely organic and have sugar. And so you have to get that sugar off, or the bacteria that's been introduced, because that everyone has bacteria in their mouth. It feeds off of the sugar. That sugar is what creates cavities. So the absolute worst thing you can do is let your kids sip on juice or milk just like intermittently all day and never clean their teeth, or all night.
Or all night. I mean, definitely a bottle in the bed is a no. It contributes to ear infections as well too. But But to that end, most babies after 6 months, they really shouldn't be. I always kind of joke when they're eating steak in the middle of the night because they're eating, like taking a bottle or. I was like, that's like milk and cookies in the middle of the night, right? And they're usually just trying to feed in the middle of the night to soothe themselves back to sleep because that's what they learned to do because they never really fell asleep on their own. So, but if you're going to clean their little teeth after you give them their nighttime bottle, then that also means they're still a little bit awake when you put them down, which actually helps them sleep better and learn to sleep better. Yeah. So it's a win-win for the baby and for the baby's teeth. So that's good. What about once you start toothpaste?
Okay.
Or like a little toothbrush. And then I remember when I took Alexi to the dentist, she was like maybe 2, and she said, you're going to want to floss her teeth. And I was like, you're nuts. She will bite me, and her little teeth were also close together. I mean, so that's really difficult. Yeah. So when to start toothpaste or a toothbrush, and when do you floss?
Yeah. So
be brave.
Toothbrush. There are these silicone toothbrushes out there that also act as teethers. And if you can get your kid used to that particular thing so they're not scared of it, that's good to introduce. Which is another teething, remedy.
Right.
But when they're really young, those first couple teeth, usually they're not like into it. But by their 3rd or 4th set, they're good. The toothpaste you can introduce anytime after they've started eating solid foods.
Okay.
Yeah, but you want to get the non-fluoridated at the get-go. Not because fluoride is bad in toothpaste, but only because they will swallow it, and you can't tell them don't swallow it, and they won't. They'll just swallow it. There's no control. And just try different flavors. My kid loves watermelon, so watermelon toothpaste it is. As far as the fluoridated toothpaste, wait until they have control over their swallowing mechanism. You can be like, don't swallow it, spit it out in the stink. Once they can do that, you can do the fluoridated toothpaste. And it's best to switch to fluoridated toothpaste at that point. The flossing is whenever they'll let you. So most baby teeth come in kind of gapped. And so if there's gaps between, then no need to worry with the flossing.
Yes.
Don't deal with that.
She had perfect baby teeth, so they were not spaces.
So you could try flossing literally between one set of teeth. And once they let you do that one thing, then you can add 2 more. Once they let you do those 3 gaps, then you add more.
I mean, I feel most people actually are either lying when they say they floss or they're terrible at flossing anyway. And so the chances of them flossing an infant or toddler's teeth is pretty low.
You want to hear the research on flossing?
Yeah, what is it?
Okay, so the research on flossing shows that most people don't floss every day like they're supposed to. Yeah. And that if you're a really good brusher, or you use like a water pick or an air flosser, every day, you're just as good as if you floss every day. And then like you actually floss once a week, you're okay. So you have to maintain cleanliness of your teeth. Okay. And you have to work in between the teeth in order not to get cavities, but the actual act of flossing every day is not what is keeping people cavity free. It's the people who flossed were following the instructions in general.
Yes, exactly.
And so
they're just rule followers.
Yes. And so, I think that it's interesting that the research has started to come out and show us that.
Yeah, I can definitely tell you, I did not avoid cavities as a child from A, lack of candy, or B, flossing. There's just no way. But I was cavity free, and so maybe it was just genetics.
Well, and the parents have to help keep the teeth clean until they're about 8. Kids don't have the dexterity to actually brush properly. They definitely don't have the dexterity to floss. And, so it's up to the parents to help keep their teeth healthy until about 8 years old. And around 8, you can start transitioning the responsibility to the child.
Oh, wow, 8.
8, yeah.
All right. Well, 4 kids down, I'm pretty sure I transferred that a little too soon then. All right, so that's good to know.
How does a parent survive it? It's okay.
Did they die?
No.
Low cavities. What about bottles? The other question is, sometimes you're breastfeeding, breast is great. Yes. And so one question we'll get is, sometimes they'll transition to a bottle, or maybe they're even still breastfeeding, and then so how long, and we'll kind of focus more on bottles.
Sure.
But is there a certain age? I can tell you what I tell parents.
Sure.
I tell them 18 months, and the reason is because I feel like by 18 months, the little child's very in control of this bottle. And they're likely to end up wanting to take it with them to bed. And it's kind of convenience. And so those cavities that can happen on the top of the teeth, and trying to avoid those. And so, and I think that's a good age to kind of nip it a little bit in the bud. And because, by then we want them eating all their food and drinking out of a sippy cup water and learning all these things instead of self-soothing with a bottle. So I tell them 18 months. Is that correct? Am I being too strict on them? But I will say, when I say 18 months, I feel like it's when you ask people how much wine they drink, they all fudge. So I say 18 months knowing that probably by 24 months they'll stop.
Sure. So I think it's great to kind of wean them off from all those things at around 18 months, and with the goal being 24, just because there's some psychological studies showing that suckling's kind of our first addiction. Addictions don't really go away, you replace them.
Yes.
So I think that replacing that suckling addiction for your child is kind of a funny way to look at it. Is good. It's good to start transitioning on different things, right? As far as
how do you transition them to sleep?
Okay.
Sleep in the middle of the night to their addiction.
Yes. That would be a great addiction.
That would be a great addiction.
So
what do you think?
I think that as far as the teeth growing in orthodontically,
yes,
from an orthodontic standpoint, it needs to be 3 years or less by the time they're not doing a finger, pacifier, bottle, anything.
Okay.
So that their palate doesn't squeeze in and their teeth come in really crowded.
Okay.
And their bottom teeth kind of come in back, their top teeth come out.
Yes.
And so orthodontically, that's the hard cutoff. From a dental standpoint, it's going to cause your child's baby teeth to kind of crowd up, and hopefully it'll go back. But I think that it's good to kind of get that done earlier. The earlier the better, because then you're not battling a 3-year-old,
right,
or someone in the middle of the terrible twos to try and break that habit. So that's why I would say, like, if you can go without it, go without it.
I think that thumb sucking is the hardest one. Like the thing with pacifiers, so the reason I'm always a fan of pacifiers over thumb sucking is, like, you can throw it away.
Right.
And, you're the enabler, so if you just don't give them the pacifier, they might suck on something else, but usually they won't. But when they thumb suck,
can't take it away.
We can't cut off their thumb. It's wrong, obviously. Bad advice. And there's all these tricks. What are your best tricks for getting them to stop thumb sucking?
So there are things that are sour, and for some kids that works.
Except for the kids who like sour.
Exactly. So then if the kid likes sour, then the next best thing is to find some sort of sock or something to put on. But then you can't just put the sock on, because in their sleep they'll pull it off. You literally have to find, like, I'm a big fan of duct tape, like, not too tight, like, you don't want it too tight. You just want it tight enough that it can't get over this, like a bracelet, you know? And then they can't subconsciously do it.
Okay.
So that's the best thing I've seen is some sort of hand coverage with something that keeps them from being able to pull it off just in their sleep.
Okay, in their sleep. Okay.
Yeah.
What about are there any issues that you see in, like, infants and toddlers that later contributes to them needing orthodontics later? Yeah. So you said the pacifier or the thumb sucking, maybe doing that for too long or bottle would contribute.
It will.
But because I got through without braces, so I don't know what I did that was different than I feel like everyone else or a lot of people.
Yeah.
So is there something that we do that actually is kind of predisposing us to definitely need braces later?
Yeah, there's a few things. There's soft diet, so you want your kid on raw fruits and vegetables in steak and stuff. You don't want them eating mush, because it actually doesn't help develop their muscles and their bones.
Right, okay.
So having a healthy diet that's full of, like, lots of different colors that are crunchy, that's super important for your teeth, actually, and your alignment. Then the other thing is we have a lot more allergies in our culture right now.
We're working on that.
We are.
It's different talk.
But the thing that people don't realize is that when your nose is stopped up, you become a mouth breather.
Yes.
When you become a mouth breather, then your palate shrinks, your teeth are more crowded, you're more likely to have buck teeth. You're also more likely to have your teeth separated in the front. you don't develop your muscles, you have a longer face, it actually changes your face shape and your development. So people don't realize that about the allergy thing. The other kind of key thing is tongue posture and speech. There's something going on that I'm seeing more and more of, even in like 10 years ago, where people are kind of like putting their tongue down and out instead of holding it at the roof of their mouth.
Okay.
And I think it might be because of some of this allergy stuff, but their mouth breathing a lot more and their tongue posture. Then when they're talking, a lisp is more common, I feel like, than it was a few years ago. So getting your kid in speech therapy and getting rid of that cute lisp or whatever, actually, it will make them sound more intelligent, number one, as they grow up without some sort of speech difference. And number two, learning to control their musculature of their mouth, it will actually set them up to have straighter teeth and better developed jaws and muscles. It's kind of a funny thing that's going on.
Well, I think there's a lot of tongue ties. And then the question is tongue tie or lip tie contribute at all? Because like when they have a lip tie, that's when, and you can probably describe it better, but their frenulum is basically attaching down between where their bottom two teeth or top two teeth come in, so they have a gap. I call it the Michael Strahan gap.
It is.
Or Lauren Hutton.
It is.
And so it's like a gap. And so a lot of times, does that need to be removed in order for orthodontics to work? Because otherwise you're just fighting still against that something structurally that's there.
Yes. So if you want that gap ultimately closed, you're going to have to change the structure there, because so the tongue tie is a little different than the lip tie, actually.
Yes.
So the tongue tie can be done with a laser at young age, and usually it helps with breastfeeding anyways, and you kind of do it as they're a baby and it doesn't really come back. And it kind of helps the breastfeeding immediately. So that's kind of something you can do at any point in time because it's a soft tissue thing. So the lip frenulums, which are on the front, right between your lip and your teeth, both upper and lower, you can see issues with either. The bottom one doesn't tend to be as much of an issue as the top one for people. The top one, you have the soft tissue part, and then you actually have ligaments that go into your bone and kind of interweave with the midline of your upper jaw. And what that does is it keeps the teeth and their ligaments, because there's ligaments between the bone and the tooth, those ligaments then cannot infringe on the midline ligaments, and so your teeth cannot be forced together by orthodontics.
Right.
And so because of that, you kind of can force them together with the braces on, but you have to have something bonded, or you have to have an oral surgeon or a periodontist go in there. And not only do you release the soft tissue, you also release the fibers that go into the bone.
Oh, okay.
There is debate, continued debate, amongst orthodontists and pediatric dentists on whether or not you should remove those fibers prior to orthodontics or wait until the orthodontics are on, and whether or not it will relapse, like the fibers will regrow. So go to one that you feel comfortable with on the timing as far as organizing all of that, and work with that team. There's not a right or wrong answer as far as the literature goes right now, and so I think you just go with the best judgment of someone you trust.
Okay. Yeah, and I do think we see more speech delay than we ever saw before.
It's something. And I'm seeing them more at like 7, 8.
Yeah.
And so I feel like I've just seen a higher percentage. You would know.
I don't know. I feel like we see. I don't know. I just feel like there's more tongue tie for whatever reason, and there's definitely more speech issues than I feel like we've had before. And yeah, so it's a little epidemic. I'm not quite sure what's triggering it, but kind of is something in there. Okay, X-rays. So I also get asked because I get asked everything. I mean, I get some interesting questions, and so they're like, "This." If I go to the dentist, so the question is when to show up to the dentist for the first time, and I get a different answer depending on who I ask. If I ask a family dentist, they'll say like, "Oh, when they're like 3."
Okay. And
then if I ask a pediatric dentist, they say as soon as that first tooth pops in.
Yep.
And a year at the latest.
Yes.
And then so a lot of times parents haven't gone by a year, and so I'm like, hey, just in this year, go ahead and go. Even if it's just that they get used to sitting there. But then the question is, do they also do fluoride treatment when they're really little or not? And because at some point they start fluoride treatments in children too. Right.
So as far as the first visit goes, I don't have a stake in this game. I don't see them first. And
yes, that's what I asked you.
And so I would go at a year.
Yeah.
And they're probably 90% of kids are not going to have some sort of issue or have anything done, but it is about having several good experiences with your pediatric dentist so that your child is kind of psychologically conditioned to, this is a safe place. They kind of just sing songs to me and look at my mouth like, this is great. Then if there is an issue, which hopefully there's not, but if there is, that's not their first experience and they're completely traumatized the rest of their life.
Right.
So it's really important psychologically.
Yeah, you really don't want their first visit to actually be, and by the way, they have cavities that we need to correct.
Yeah.
That usually ends up poorly.
It really does. And with children, if there's a bunch of cavities in one mouth, they end up getting sedated. And that's their first experience, or their second experience. Like they go in, they get told bad news, so they generally associate that office equals bad news.
Yes.
Then their second visit is, I get put out and feel funny the rest of the day. That's not a fun experience for anybody. So, yeah, not good. As far as the fluoride goes, when you're doing a fluoride treatment in a pediatric dentist's office, they have specialized fluoride and tools and they're trained in how to apply that fluoride that's safe for your child. It's not an at-home treatment where they might swallow it or they might not or whatever. And so I think that whatever the pediatric dentist is using and suggesting, you do, because they're trained not to let it harm the child. They know what dosage they're putting in there. They have the tools to keep them from swallowing it. It's really a great thing because the fluoride actually integrates with the outer tooth structure and it really can help prevent cavities. So.
And when do they do their first set of x-rays?
Oh gosh. I would say whenever the child can sit still enough. And the dental x-rays.
I mean, it's hard, like those bite wings.
Yes.
I guess in my head, I dread getting x-rays because I think it's hard to actually do the bite wing thing.
It is.
I have a small mouth.
I got my cleaning yesterday, and they put them in, and I was like, oh my gosh, I've forgotten.
Yeah.
And I'm not a child, and it's the X-rays are getting lower and lower and lower dose.
Okay, that's good.
And especially because we've got digital, so every year, every manufacturer is like, this is the lowest dose ever, and so that's amazing because we're getting the same diagnostic information with less radiation. Secondly, dental X-rays are not a high dose of radiation. So, the bite wings are, I think it's equivalent to like the radiation you get in a banana or something. So the one that goes all the way around your head and is called a cone beam, and it does the whole head and everything, is the equivalent of flying from Houston to LA. Yeah. So like if you got on a plane and Panoramic. Well, no, this is a cone beam.
Oh, okay.
Yeah. So the Panoramic's even less.
Oh, there you go.
But if you're going to get a pano and the side one, which is called a cephalometric one, it equals like one cone beam. So,
which is a flight from across the country.
Yeah.
I think people don't realize they get radiation exposure when they fly and do other things.
Yeah.
Yeah, so then there you have it.
There you go.
So we probably shouldn't worry about the x-rays.
I wouldn't.
Okay.
I wouldn't.
Okay, so now we made it through our child years, and now we're like in elementary school. Maybe we're starting to go to middle school. I don't know. And I feel like they're losing baby teeth and they're getting adult teeth. They're all coming in crooked. Hello. You're like, oh, you're definitely getting braces. When should they see the orthodontist for the first time on average?
On average, I would say 4 or 5.
Oh, wow. 4 or 5.
I would. And I definitely have seen down to 3-year-olds.
Oh, gosh.
And there's a couple things. There are probably 2 things I would fix in a 3 or 4-year-old, and only if the child is willing to undergo treatment without it being a traumatic event for them. And we've always said 6 or 7. The AAO, like all the official literature says 6 or 7. The reason I say younger is that whole psychological concept again. If they're familiar with me, and we can see that they have a crossbite or an underbite, which are the 2 things I'm talking about that I would go in earlier than later, then when we get to 6, 7, 8, when they're psychologically ready for it, they're like, I love this place. I love Dr. Cooper. This is a good thing. And so that's why I like to start seeing them younger. It's just develop that relationship with the kid.
But it's the dentist who normally says, go ahead and see the orthodontist. And so depending on how their bite is and all that stuff.
Yeah. Okay. But I would say 90% of orthodontists that I know monitor for free. Yeah. All of us do.
Right.
So it's like, have us look at it.
It's free.
It's free.
I'm always in on anything free. I'm like, it's free. I mean, let's see.
Yeah.
Okay, so our braces, so not every country, I'm not going to point out any country specifically, but you probably know what I'm talking about.
Yeah.
Not every country actually gets necessarily routine orthodontics like the United States does.
It's true.
Okay, without listing any other countries.
No, it's
But,
yeah.
so are braces in the United States purely cosmetic? I mean, I'm sure there's a few cases where it's like, no, you really need to do this, but in general, is it purely a cosmetic thing or a functional thing?
So this is funny because we've been shifting our perspective as a whole profession. Like dentistry as a whole has been shifting. We used to think it was more cosmetic, and that of course there was that 30 to 40% of the population that really needed it, but 60-70% of the population really didn't. Right. And then United States went more into that part that didn't necessarily need it than other countries. But what we've actually been finding, it's kind of like preventative medicine. So medicine for the longest time was reactive. You have
it still is in many ways.
Yeah, you have a disease, you take antibiotics.
Right.
You don't see, wait, what helped cause that, and can I do something different, like probiotics, you know, and then maybe I have a little bit more boostering, right? So orthodontics actually falls very much in the category of preventative dentistry. Because if you can align your teeth and they fit together, and then you can place the forces on the teeth properly throughout your entire life, you're much more likely to keep your teeth when you're 70, 80, 90. And we're living so much longer because we have good medical care. We're learning more about that. And so you need to keep your teeth longer.
Right. And that is actually a really good point because I know my grandparents had false teeth.
Yes. And that generation almost expected to have false teeth by a certain age.
Oh, no. Yeah, completely. Everyone had dentures. So I don't think I could think of anyone, and this was, I guess, the 80s, you know, when my grandparents were in their 60s or so, that they didn't already have dentures even in their 60s.
Right.
Right. Okay, so if you don't want dentures.
If you don't want dentures, then you want orthodontics to create the optimal functioning process for yourself.
Okay. Well, now I have fingers crossed because I never had braces. I always told my teeth were straight, and I don't want dentures.
You know where to find me.
All right. Guys. Maybe I'm going for my free evaluation now. Oh my gosh. All right, so what's the latest and greatest? Because no offense to braces, but
they're awful.
It's dreadful.
So
I always dread that time period of my child's life because the poor thing, they got metal in their mouth. They're going through like awkward puberty.
Yes,
it's the worst thing ever.
It really is, and I totally feel everyone's pain on this because I was in braces so much.
Yeah, sounds like it.
So, and I only had metal braces. It was not even an option to have something else.
Okay.
So the latest and greatest are, I think, two things. We're really, really getting competent with clear tray treatment. Okay. And not only do we have Invisalign that kind of helps people do more advanced treatment if they, even if they don't, how do I say this? Even if you don't exactly know all of the different mechanics, Invisalign can help give a good result. And so it's kind of bolstering that. And then on top of that, all the orthodontists I know, we're all bringing that stuff in-house so that we can control it because we know how to control it, right?
Okay.
And so there's so much more clear tray options available. 10 years ago, we were like, that's good for minor movement, but not major stuff. I'm fixing underbites, overbites with it, you know, adding elastics, different auxiliaries. It's really working well.
So a clear tray would be something they can take on and off?
Yeah.
Oh, okay. And then and they could do it even if they were like 11, 12 being braced for the first time?
Absolutely.
Okay, so I always thought of Invisalign, at least like 10 years ago when, you know,
Sure.
during all of my children's time in braces, I would say no one mentioned, why don't we do Invisalign?
Yes.
They all just said, no, we put the little metal things on and which color would you like? And then rubber bands.
Right.
So even at a young age, for your first time getting braces, you're saying you can do something like an Invisalign or something that's a clear tray.
Yeah.
And for around the same amount of time, which we said was like 20 to 22 months, as they were in braces on average?
When you're in a teenager, the average case is 20 to 22 months.
Okay.
So yeah, it's about the same amount of time as long as you wear it. And the other thing that's really cool, that's really getting stronger in the U.S., I feel like other countries have been using it more than we have, is the braces on the back of the teeth.
Oh, interesting.
Yeah. And so everything's becoming computer digitized, planning the smile from the get-go, and then, you know, we're working towards it. So it's requiring less appointments, and we're getting the same or better results.
Right, because that's actually the thing that to me was always a bummer about braces. Yeah. And I feel like it has gotten better as time went on, but they had to go so frequently to get these things adjusted. And it's such a quick thing, too. So on average, when they're using the clear tray, like how often would they come in to get something done?
Every 3 to 4 months.
Oh, that's really good. Every 3 to 4 months.
Yeah. Same thing with the braces on the back of the teeth. There's reasons. The appliance is a little different, and it has loops so you can floss with it and things. It's not the same as braces on the front, or at least the appliance I use. So, yeah, I think that it's a really good option, and we're getting better and better at, you know, remote monitoring.
Yes.
So we have an app that just came out this past year that we've been using a little bit, and people will have cheek retractors at home with little red dots so that the computer can scale it.
Cool.
And so even though they're not seeing me every 3 to 4 months, but they're not seeing me every 3 to 4 months, they're scanning in every week, and I'm looking at the pictures. And there's AI built into the app, and we're making sure it's tracking, and that's how we're able to make it more efficient.
Oh, that's very cool.
Yeah. So when you come see me, we do stuff. We don't just like, where are you?
Right. Okay. So on average, they see you every 3 to 4 months, but they're using an app to take this picture, and they have a cheek retractor at home.
Yeah.
Some are,
some aren't. We have some patients that are seeing us every 3 or 4 months that don't have the app. We have some that are. We're gonna.
See which.
Yeah.
Yeah, I think I'd rather do the cheek retractor and like kind of keep an eye on it.
Right.
And at least that's what I would do. All right. So you answered the question of how long they had to be in braces. So like 20 to 22 months. And do they do permanent retainers?
Okay.
I asked this because I have a child with a permanent retainer, and I was like, really? I was like, okay, I'm just kind of going with the flow here, but permanent retainers?
So every office is different.
Okay.
And a systematic review came out last year that showed, so number one, orthodontists have always called it a permanent retainer, but they will break, or they can bend and push your teeth out of alignment, or they can gather bacteria and cause you to be more predisposed to like gum and bone disease or cavities. If you don't keep it clean, you're okay. And so the study came out and showed that there was minor shifting of the teeth, even if they were bonded.
Okay.
And if you actually wore your removable retainer at least once a week, well, you have to wear it like every night, then you like taper down. But 7 years after you're out of braces, you need to wear your removable retainer at least once a week. And this was 20, 30 years out of braces, this study. People who actually were wearing their clear retainer once a week, 20 to 30 years out, and people who had bonded retainers 20 to 30 years out had the same amount of tooth shift. And so I'm like, why bond stuff on if all you have to do is wear some clear retainer once a week, ultimately, until you know you don't want straight teeth. So,
well, that doesn't sound promising at all.
I don't know. No, shift happens. If you're not wearing a retainer, your teeth are shifting. I don't know. There's explanations.
I feel like there's like a really good talk that could be called "Shift Happens."
Yes, there's a couple.
I'm sure there is some interesting slides.
Yeah.
Okay, so I don't think I realized that. That's a bummer.
Well, it's okay. I mean, and also.
So maybe this explains all those adults who are getting braces.
Oh, it totally
had
does.
it when they were little, and now they're getting Invisalign, etc.
Well, and we thought 30 years ago that if we centered the teeth over the bone, as a profession, we thought if we centered the teeth over the bone, that it would be stable and you wouldn't need a retainer. So everyone our age was told, stop wearing your retainer.
Yeah, of course.
When you're 5 years out or 2 or 3 years out or whatever.
Right.
And they did not realize that shift would still happen. Because they thought they were centering the teeth over the bone.
Right.
That's why they would take out permanent teeth to center the teeth over the bone.
Right.
And what ended up being shown is it didn't keep the teeth from shifting.
Oh.
So that theory is completely debunked, and you must wear a retainer or your teeth will shift. So, yay!
Yay! This has been great. Very uplifting.
Yeah.
You guys see that orthodontist the rest of your life, but you won't get dentures.
You won't get dentures. Would you rather see an orthodontist than the oral surgeon taking out your teeth?
Yeah, no question.
Yeah.
No question. And I do think that's a really legitimate problem. And in a lot of countries, they do have very poor dental care. And so in the United States, we're at least fortunate that we have very good access to dental care. But there's just so many options. And I think, finding the right fit for the right child is the right answer.
Yeah,
So
definitely is.
I'm all over the Invisalign idea though. Or maybe even the back braces or something where it's not poor metal mouth. It's just.
Well, and I think we're going to come out. Okay, so this is where the editor-in-chief of the AJODO, which is our national orthodontic magazine, he was my department chair.
Mm-hmm.
And he's written about it a couple times, and he thinks that the next evolution in braces, yes, we have all this computerization and customization. We program the smile ahead of time and program the movements. He thinks that we're going to come out with some sort of nanotechnology that will move the teeth, and so it might be on the front, but it might pretty much be invisible. And so I'm waiting for that product.
Yes, I know. We have a lot of other things we also need to work on in events, so.
This is true.
The app is very cool. All right. Well, thank you very much.
Thanks.
I think that answered at least all the questions I get commonly asked. And now, even for my own daughter, I have a better sense. I can guarantee you we didn't see orthodontist at 4 to 5 years. And I'm certain my older two kids are no longer wearing their retainer, so I'm going to call them and talk to them about this retainer issue because, well, it's in their hands. Like, once you're an adult, I'm like, you get to pay for the second set of braces yourself.
Mm-hmm.
So, I'm good for the first set. And so, but great information. Thank you very much. Cooper Orthodontics. You have a website, I'm sure, and a Facebook page. We follow her on Instagram. It's fun.
Yeah.
And so, thank you for joining us.
Thanks
and
for having
telling
me.
us everything about teeth. So,
Wonderful.
all right. Thanks. All right. Bye, everyone.